So our agenda is that we're going to first hear from Professor Rita Goschert, and she is the director of the Child Life Program at the Children's and Women's Hospital in Long Beach. And so she has a lot of great information to share with you about becoming a child life specialist in that career. And then I'm going to give you just a little tiny bit of information on, specifically how to get some advisement at Cal State LA and in the Child Development Department, for this career pathway or for others. And then we will be having an alumni from the Child Development Program at Cal State LA, and that is Amy Mahano, and she is going to be talking about her experiences working as a certified child life specialist. So I hope you're ready for hearing all of this information this evening, and we're going to go ahead and get started. So I want to introduce you to Rita Goschert, and I will let her give an introduction, a little bit more information about herself and her career pathway as well. So Professor Goschert.
Hi, everybody. Thanks so much for joining us tonight. So excited to be here and to share this wonderful career path of the child life specialist. And I know many of you may have questions, so please feel free to jump in. Hopefully I'll answer most of your questions. But as Dr. Dennis said, I think it's probably best for me to start at the beginning as well and let you know how I became a child life specialist, because I think it's you always gain a lot of insight and wisdom into listening to how different people kind of went down that path. So I started my pathway a long time ago. I've actually been at Miller Children's Hospital for 35 years, so a long time. This summer was my 35th anniversary. But I was at Cal State Long Beach, and I was in the department was called Home Economics at the time. And but I had all my classes were child development and family studies. That was kind of my specialty. And I was in my last semester, and I was taking a class that they call an internship class. So it's doing 120 hours of internship at a site, and we could choose from many different sites where we would do our internship. So I was looking through the different options at the time, and it was my very last semester, getting ready to graduate, so excited about graduating, but still didn't know what exactly I was going to do when I graduated. So I was kind of a little bit in limbo, knowing I wanted to work with children and families, but wasn't quite sure which path I wanted to go down. I didn't think I wanted to go to the teacher path, which many of my friends were doing. Anyway, so as I was looking at the different options, one popped up that said Miller Children's Hospital and said child life specialist. I never heard of it before. And at first I thought it was a mistake, that it belonged in the nursing department, not in child development. And when I read some of the examples of what you would be doing as having training and knowledge in child development, working with pediatric patients and their families, I thought, wow, this is pretty interesting. So I went down, I've completed all the steps to become, at the time was called a hospital volunteer. And I started my hours with every intention of finishing my hours super quickly and getting ready to graduate and excited about that. Well, it was truly an aha moment for me. The very first time I was volunteering, my very first day, I was in one of the playrooms, and I was sitting down at the little preschool size table, and a nurse brought a little patient in a wagon with her IV pole hooked up to the wagon. And the little girl, she pulled her right up next to me, and the little girl looked at me, looked at some toys at the table, and kind of patted my lap, like, I want to get out of that wagon and sit on your lap. And that was it. I had the child life specialist help me. We got her because she had lots of different, tubes and things she was attached to. And that was my, confetti flying out of the sky, light bulbs going off, whatever happens for you. But it was really at that moment, that very first moment that I worked with a pediatric patient, that I knew this is what I want to do with my life. So I ended up putting in a lot more than the 120 hours at the time that were required of me. And I was very fortunate to be offered a position right after I graduated with my bachelor's. So I have been there ever since. So I kind of gave it away. You can maybe figure out close to how old I am. But along the route, of course, when I started, I didn't have the greatest shifts, weekends, evenings, that type of thing, very part-time. So I was also a substitute teacher for Long Beach Unified School District, because I was very part-time at the hospital. I enjoyed that as well, but really knew that my path was to become a child life specialist. So I continued on and was able to, add shifts and so forth and get more experience. And then after I worked for a few years, I decided I wanted to go back for my master's. So I did go back to Cal State Long Beach. At the time, they had a master's program. Unfortunately, they do not anymore in the child development program. So I completed my master's in their program, and worked with all of my professors to gear any of my papers, projects, anything like that, to working with children in hospitals. So even though my diploma actually says home economics, because the department was still called home economics when I got my master's, it changed the semester after I got my master's. So anyways, once I received my master's, it opened the door for some other opportunities for me. I was actually able to move up in the department to what we have called a senior child life specialist role. And then I was also able to teach at the university level as a part-time lecturer, because I have a master's and a specialization in a field. So I did start teaching soon after that at Cal State LA. I've been teaching at Cal State LA now. I can't believe this. It's going to be 23 years because I started in 2000. So quite a long time teaching at Cal State LA. And then soon after that, I also started teaching a class at Cal State Long Beach. So it's been the perfect kind of marriage, if you will, of working with children and families during the day, and then being able to share my passion and educate students and hopefully possibly future child life specialists in the evening. It's been just a wonderful path for me. And I really love sharing this field of child life with people. So that's kind of how I have come to be in front of you tonight. So just a little bit about child life, because I want to make sure to leave plenty of time for Dr. Dennis and then Amy as well. But a little bit about child life, just so you can understand. I'll do our kind of very shortened description, because I could do a very lengthy lecture for you on what a child life specialist is and what the field is. But really, when you just drill down, child life specialists, first of all, you're going to find them in children's hospitals primarily. There are some hospitals that are not a children's hospital, but they have a large enough pediatric unit that warrants a child life specialist. So you will not find a child life specialist at a small community hospital, because many of those community hospitals do not have pediatrics. They may treat pediatric patients in their emergency department, but then they would transfer that patient to a children's hospital if they need inpatient hospital care. So you typically will not find child life at a small community hospital. You're going to find child life specialists or child life programs for sure at any children's hospital, like Mattel Children's Hospital at UCLA, Children's Hospital Los Angeles, Miller Children's Hospital, Children's Hospital Orange County, and Rady's Children's Hospital down in San Diego. There's more around California as well, but those are the big children's hospitals that are closest to us. So what the goal is truly of the Child Life program is to normalize the crazy, scary environment of the hospital for children and families. And I think you all would agree that it is scary to be hospitalized, whether you're a child or whether you're an adult. It really doesn't matter. So child life specialists, with our background, knowledge, training in child development and family studies, we are able to truly normalize the environment for children, because we take in that background in child development. And so we provide everything that we can that is going to make that environment more normal. And we know, and I know you guys, maybe some of you are just starting out on your child development journey, but I think hopefully you've had enough child development classes to know that play is the work of children, right? Children need to play. Play is how they make sense of our crazy world, especially how they can help to make sense of being hospitalized or being ill or injured. So we try to provide as many play opportunities as possible, wherever that may be. That might be in a playroom if a child can actually leave their room and come to a playroom. It might be at their bedside. It might be in the emergency department. It might be in an outpatient clinic. Wherever they are, we try to provide play. And a variety of types of play. Some play that's just truly diversional to help distract them and help them forget about being in the hospital for a little bit, or play that's a little bit more targeted to what's going on with them while they're in the hospital. So more medical play, playing out maybe a surgery or a procedure with the doll that they have gone through, that kind of thing. So we try to provide just a wide variety of play opportunities for children. And the Child Life Department at Miller Children's is very large. I'm the director of the program. I have 46 people that report to me. I often say we need to change the name of the department to Child Life, because we're not just Child Life, but it's kind of like an umbrella. So we have all of our Child Life specialists, all of our Child Life assistants. We have music therapy. We have hospital school teachers, we have an injury prevention program and a family resource center program and an art program. So those are kind of all the rungs of the umbrella, if you will. And so what else is normal for children besides play is school, right? If children are in, kindergarten through 12th grade, it would be normal for them to go to school. So we definitely work very closely with the hospital teachers. They're part of our department as well, but we work very closely with them to ensure that our pediatric patients are getting the appropriate academic support that they need while they're hospitalized as well. The other thing that's normal for kids is their family, right? So being with their family. Unfortunately, COVID has thrown the biggest whammy on that for us in hospitals that you can imagine. So brothers and sisters have not been allowed in our hospital in over 3 years now. Or just about 3 years, right about now. That's been really challenging because all hospitals, especially children's hospitals, practice what we call patient and family-centered care. So we're not just treating a child that's a patient, but that child is part of a family unit. So we're really treating that whole family. And having the siblings not be able to be present, as we've experienced now for the last 3 years, has been really tough. We have done everything we can to still help those siblings understand what's happening with their brothers or sisters and really continue to keep a bond and a connection going between them, whether it's through, phone calls, FaceTime, giving resources and support to families to bring home to those brothers and sisters that can't come to the hospital. But so we're still doing everything we can to normalize the hospital environment in that way, and keeping that family as a unit, if you will. So play, family, socialization, getting children up and out of their beds if possible, going to a playroom setting where they can interact with other pediatric patients and socialize. Our playrooms are back open. They have been open for a while now. They were closed at first during COVID, but now they're back open. We still have to socially distance and wear masks in the hospital setting, but we're getting there, closer and closer, but still allowing children that opportunity to have time for socialization with other children, which is really, really important. So child life specialists, really, we just use our knowledge and training in child development to support our pediatric patients in any way we can. We also provide a lot of education to staff, because many of our other staff, not the child life specialists, but the nurses, the physical therapists, the lab techs, the respiratory therapists, we have such a variety of healthcare practitioners in the hospital, and they may not have had a lot of child development. So our child life specialists are able to also provide in-services or training in child development to the hospital staff. So we do that as well. We're definitely the patient and family's advocate, and we try to speak for the patient and family at different multidisciplinary team meetings to really make sure that that voice of the patient is at the table, so that we're supporting them and making sure that we are definitely looking at where they are developmentally first and foremost, and how can we best support them where they are developmentally while they're hospitalized. As child life specialists, and Amy may talk a little bit about this, but we continually assess where a patient is and how they're doing. And the main ways that we assess, or the things that we look at, is where a child is developmentally, what their temperament is like, and how they're coping. And definitely their coping can change from hour to hour while they're hospitalized. We might walk into the room at one point and they seem to be laughing and playing and having a great time. We might walk into the room a few hours later and the nurse may have just finished doing something that was not too comfortable, and they may be crying and really having a rough time. So we have to continually assess, where a patient is at, and adapt our interventions to meet them where they are, if that makes sense. But it all comes back to our training in child development. That is key. That is really the foundation of a good child life specialist, is having that unbelievably strong foundation in child development and family studies. If you don't have that, you really can't practice, I don't think, fully or very well as a child life specialist. So I think we should probably go down the path to becoming a child life specialist now. So we have the website, but I think I'll let you guys explore that on your own, so you can see it there. It's really important. It's just childlife.org. But once you get there, go to that certification tab. As you see here, it has /certification. If you go to the certification tab, it will bring you through the steps of what we're going to talk about on the next slide in more detail. So this slide should help you to really kind of understand the first step on the journey to becoming a child life specialist is, well, I think one step is actually missing here. The very first step, before even one, is completing at least a bachelor's, right? So that's the very first step, is working on your bachelor's. And usually people that begin the process to become a child life specialist start number one, these child life volunteer hours, while they are completing their bachelor's work. So this step number one is really that get your feet wet and really kind of figure out, is this environment for me, right? Does this work? Because the hospital environment isn't necessarily for everybody. So completing a minimum of 120 hours of volunteer experience in a healthcare setting supervised by a certified child life specialist is key. Like I said, that's that, okay, do I really want to do this or not? For me, remember, that was my aha moment type of thing. And then the next step is to complete a practicum. And I will share with you, the Association of Child Life Professionals has not mandated practicums as yet. So there's still kind of a guideline or a suggestion, but many hospitals are requiring practicums before you can complete step number 3, which is the child life internship. That's why I want to make sure that we list practicum here. So a practicum is just a little bit more in depth than the volunteer experience. So with the practicum, as you see, you're going to have more time for observation of child life specialists doing, really providing more clinical interventions. And then there are some learning assignments that would go along with the practicum. So it's just kind of a little bit more in depth than the volunteer experience. And then the next step along the journey is completing that clinical internship, which is 600 hours of clinical training, as you see here. It is an application process, an application and interview process. I will tell you it's very competitive. For instance, Miller Children's Hospital, we offer a fall and a spring internship. And we only choose 2 interns per each of those semesters. And we typically get about 70 applications. So it is pretty competitive. But once you complete this 600 hours, it's really a full immersion into the role of a child life specialist. So you are working right alongside the child life specialist on that particular unit that they're on. So you have different unit rotations, as it says here. First, you're observing and really understanding how we do what we do, and then you're jumping in and providing preparations for medical procedures for children, distraction through uncomfortable procedures, medical play, conducting assessments, as you see. So when you successfully complete the 600 hours of clinical internship training, and you are then really ready to practice as a child life specialist. However, there's one last step. As you see here, there is an exam. We are, as we've said a few times, we are certified child life specialists. So after completion of the certification exam, that is the final step. That is the certification. And then your certification again needs to be renewed every 5 years. Through education, through professional development hours. And that's how we kind of keep up on, advances in the field and things like that to keep our certification up to date. So that's kind of the steps to becoming a child life specialist. And typically you would graduate with your bachelor's probably right after your practicum. And then usually anybody that's completing an internship with us has completed their bachelor's. Some of our interns are in a master's program. There are some master's programs that the 600-hour internship is actually a part of that master's program. But you have definitely completed your bachelor's before you're moving on to your 600-hour internship.
I have a question. So our class 4260 currently combines the volunteer hours and coursework. Is it considered a practicum, or is it considered, would it be considered separate from a practicum?
That's a great question. And I can only speak for Miller Children's Hospital because each hospital kind of handles things a little bit differently. So at Miller Children's Hospital, we have worked with our students from Cal State LA that are enrolled in the hospitalized child class 4260. And yes, we have been able to count it as a practicum because the assignments are part of the class. So the journaling and things like that are part of the class. There are a few other hospitals also that will work with the students that are enrolled in that class and count it as a practicum as well. I will say that things are kind of changing a little bit through the Association of Child Life Professionals. So I still believe we'll be able to do that for 4260. We may have to change some of the assignments in 4260 to match, but I think we'll still be able to do that moving down the path. But that's a great question.
And well, yes. And starting next year, we're going to be sort of separating the course from HHS 4950. But I think we could still we could think of how we would maybe combine those two together to make them a practicum experience. For example, yes. If people took them at the same time. Exactly. Jennifer has a question.
Hi, yes. So I know for the exam, I'm pretty sure most likely it is only for the state of California. Is there like a website where we can like if there's an exam for like a different, I don't know, like for us to be certified in different states?
Yeah, so that is the great thing about the field of child life. It isn't like, I believe, teaching, you have to have your teaching credential from that particular state. That's not how it is for child life specialists. You can take it's the same exam. Well, of course, they have variations of the exam, but it's the same basic content, no matter what state that you take your exam. And then the exam is offered, I'm sorry, does it say here? I think it's offered, Amy, do you know for sure? I want to say 3 times a year or 4 times a year.
I think it's 4.
4 times a year. I think it's
I think it's almost like quarterly.
But yeah, that's a great question. You can take it in any state. And so I'm a certified child life specialist here in California, but if I move to New York and I get a job in New York, my certification is valid there as well.
And do you know of what are the most common schools that people are going to for their masters? I know we're gonna, have Amy. A lot of our students in our MA program, they kind of specialize in child life, even though it's not an actual child life master's program, and they might do their field work and their project and things like that focused on child life. Are there some other schools that you would recommend for the master's program?
Yeah, I never like to say I recommend, but I will say I would say Cal State LA. We definitely have worked. When I say we, I mean Miller Children's Hospital. At Miller Children's, we've worked with many of the Cal State LA students that are doing the master's program there as well. So know that Cal State LA is always an option. I will tell you that there are a few private universities, Azusa Pacific, that are local. I'm just going to tell you ones that are fairly local. Azusa Pacific, University of Laverne, and Loma Linda. Those are all fairly local universities that have masters in child life, and their last semester of their master's program is the 600-hour internship. It kind of culminates the master's program. And what I have heard from students that have taken have gone to these different schools is that they also can kind of help you, not necessarily get the placement for you, but they guide you a little bit, and they can give you some extra support in helping you to get your internship secured, if that makes sense, because they definitely want to make you successful and help you to complete your master's program. But those are the three that I'm familiar with that are local, that have masters in child life. I believe there's also an online version through the University of Santa Barbara that's also a master's program.
Does the internship, how long does it usually take for somebody to complete that?
A semester. It's about 15 weeks.
Okay.
It's full-time. It's 35 to 40 hours a week for about 15 weeks. And it sounds rough, and we've gone through a lot of changes over the years. I probably was the last one with my heels dug into the ground saying, no, we have to continue to offer a part-time internship for people that work. Well, the experience is so much better when you have this, when you're working as right alongside full-time child life specialists, full-time with them, you know what I mean? When we were doing the part-time internship, there was a vast difference between our interns that were completing a part-time internship that was more spread out and watered down a little bit versus the full-time, if you can imagine, because like I said, you're there for full-time and you're experiencing pretty much everything that's going on. For instance, Amy you might not even be working with Amy that day, for example, and she may be going, I didn't even mention this, but Miller Children's is connected to an adult hospital. So we're also able to provide support to children of adult patients. So Amy may be going to provide bereavement support to a grandchild of one of our patients that's dying in the adult hospital, and she would be able to pull that intern and say, come with me, you're going to come experience this. So you get to experience a lot more, obviously, doing it full-time. So we've only been offering a full-time internship for quite a few years now. It's been quite a while.
And then Sandra in the chat said, if you get certified in the US, does it also work in a different country?
I am 99.9% sure. I believe so. The Association of Child Life Professionals it's an international organization, actually. So we are all kind of governed by that organization, no matter what country you practice in. So yes, it is good in any country that you practice in.
Okay, is there any other questions? Let's see. We have, I can't, your.
It's okay. I go by Jen.
Okay, thank you.
I have a question. If we were to do, let's say if I do the practicum here at Cal State LA, and later on I wanted to do my master at a different school, would I still able to use that practicum as my hours for the internship, or like to?
No. And just to be really clear, the practicum hours are also in a children's hospital. So just like the volunteer hours say that you must be in a healthcare setting supervised by a certified child life specialist, it's the same for the practicum. You must be in a healthcare setting supervised by a certified child life specialist. And unfortunately, no, the number 1 and number 2 hours do not count towards the 600 hours. They're completely separate.
Got it.
So when all is said and done, you're going to at least have 720 hours, and sometimes maybe even a little bit more than that.
Okay, got it. Thank you.
You're welcome.
And
have a
then,
question.
oh, go ahead.
So, does Cal State LA offer a master's in child life specialist in becoming child
No,
life?
our master's program is general, and so it's just called Masters in Child Development. But you do field work, and so you can do, field work. You could consider, and I think your field work, if it was supervised by a child life specialist certified, it would be considered a practicum, correct? Yeah.
Probably. Because what's the amount of hours for their field work?
At least 135 hours.
Yeah, so it would be close. It would be the practicum.
Yeah.
Okay, thank you.
I will just jump in and mention of my staff, and I told you I have like 46 people. They're not all child life specialists, but the majority of them are. I want to say we probably have 35 child life specialists on staff, close to that, maybe 30. The majority of them do not have, well, first of all, a master's is not required yet to become a child life specialist. That's number 1. I will say we're pretty certain it will, but I don't have a crystal ball, but we're pretty sure that they're going down that path, but we're not there yet. So right now a master's is not required. A bachelor's is required. And the bachelor's is in child development or a related field. I think now it says child life, child development, or a related field. And of my staff, just to give you an example, the majority do not have either a bachelor's or master's in child life. They have a bachelor's or master's in child development. Just to put that out there. Like Amy and myself, we both have both bachelor's and master's in child development.
And then we have a question. If we were to start volunteering in the year before getting a bachelor's, around how long would it take to become certified?
You still would not be able to be certified for a semester after you graduate, because the internship will last you, like I said, a full semester, basically 15 weeks. So it would be, let's say you were graduating in the spring of 23, and then you completed your internship in the fall of 23. You couldn't take the exam then until whenever they offer it in 2024. Does that make sense? Now, there may be some hospitals that offer a summer internship. We do not any longer. We used to, but now we're just offering a fall and spring internship. So if you found, I'll use that example again. Let's say you're graduating with your bachelor's in spring of 23, and you were able to apply to a hospital that actually offers a summer internship, and you're accepted, and you complete your internship in the summer, then you could take the exam in the fall of 2023 and be certified by then. But I'm not sure, and Amy might remember better than me. I don't think there's too many hospitals that offer summer 600-hour clinical internships.
Not that I'm aware of. I think we just recently stopped offering the summer one.
And you said that it's pretty competitive. There's usually only a couple of people that are accepted. How many applications do you usually get versus how many are accepted? Do you need a high GPA? What are the kinds of things that help to get the internship?
Great questions. We typically get about 70 applicants per semester. So it's a lot, and it's really challenging for us as child life specialists because a lot of applicants look fantastic. So it's really hard to kind of, narrow it down to the top. So definitely we do, we have to use things like GPA and things like that to help us when you're looking at 70 applicants that for the most part are pretty closely, equal. So I would say GPA, as well as your experiences with children in general, whether that's with, I shouldn't say whether, a combination of experiences with healthy children, as well as your volunteer experiences in a children's hospital. There's other opportunities to work with ill children or chronically ill children, like there's camp settings that you could volunteer in. So we've had applicants that maybe they have great experience with healthy kiddos, say in preschool classroom experience, and then they volunteered in a children's hospital for quite a while, and then over the summer they volunteered in one of the summer camps for chronically ill kids. So they have really quite a nice background of different experiences with children of different backgrounds, and also having experience with children with a wide variety of ages, I think is really important, because when you're working in a children's hospital, you're going to be working with children from birth through 18 at least. Our hospital, we actually treat through 21, so we treat through young adults. So it's great to have experiences with a wide age range of children as well.
And I know you had one more slide about classes. Did you want to go to that one?
Sure. I don't remember that slide. I'm sorry. Let's see what it is.
Did we?
Oh, that was
This
yours.
one, yeah.
Oh, this one. Yes. No. But sorry about that. It's late. It's been a long day. So this is what is super exciting about being a student right now at Cal State LA. Cal State LA worked very closely with the Association of Child Life Professionals, and these are approved classes from the ACLP. So if you go down the path to become a child life specialist and you take these classes, you will meet the academic requirements, no questions asked, because these classes have already been approved. So the first is having a class taught by a child life specialist. That would be that 4260, the hospitalized child. And then you can see very clearly two child development classes, 1400 and 3400. You only need one family systems course to go down that path of becoming a child life specialist. And we have quite a variety to choose from here at Cal State LA. A therapeutic play class, which is 4460. A loss and bereavement class, 4800, a research class, which is 2000, and then just 3 additional classes that you've with context to child development. So this is actually really exciting. I will tell you, Cal State Long Beach does not have this, and it has been a little frustrating working for those students that may have to go to other universities to try to get some of these other classes that they may not have. And it's not that they don't have them at Cal State Long Beach, but they haven't worked with the Association of Child Life Professionals to get it approved. So these are approved classes.
Andrea.
Hi, yeah, I have a question. So previously you had mentioned that it looks good that people volunteer at summer camps. I want to ask you, is there any summer camps here in Los Angeles that are offered for people to volunteer for the chronically ill children?
There are, and I'm going to let Amy answer that question because she's better suited for that. But I just want to say, I use that as an example. It doesn't mean you have to.
Yeah, I understand.
Yeah, I just want to make sure
No.
a bit more, a broader background of working with children. I'll let Amy tell you about a couple of camps that she's familiar with.
Thank you.
Yeah, so there are several camps in Southern California that help kind of with kids with chronic illnesses. The 2 main ones that are here in the Los Angeles area are the Peanut Turtle camps. So Peanut Turtle is an organization that offers a lot of different opportunities for different chronic illnesses. So it goes from like spina bifida to oncology, blood disorders, things like that. And they just provide like a chance for normalization for children. Sometimes they're not able to attend summer camps because of their chronic illness. And Peanut Turtle also offers a separate camp for brothers and sisters of these children with chronic illnesses to kind of have them gain a support network for them. The other one is one that I actually volunteer for. It's called Camp Ronald McDonald for Good Times. That one is specifically for children with cancer and their siblings. This one offers the sessions throughout the summer, and they offer winter sessions as well and family sessions. So the summer sessions are a mix of patients and siblings. So that way, and we don't know who's who. So it kind of just evens out the playing field for everybody because some of these children are in different stages of their treatment. There are a few other within California. I don't know much about how to get enrolled into those camps, but these camps are pretty great. They just offer a great chance for them to be normalized, an experience for kids during the summer. And it kind of gives them a chance to relate to other children that have either gone through the same thing as they have or have experienced a sibling with a chronic illness. And they just offer different sessions throughout the summer. Most are back up and running after COVID. They had quite a bit of a pause during COVID just because they were trying to make sure all these children with chronic illnesses stayed healthy. But now they're back and running with different requirements now. But those are the two main ones within Southern California that I am aware of. And we actually work with Peanut Turtle.
Painted Turtle, and what's the other one?
Camp Ronald McDonald for Good Times is the other one.
I'm typing the other one for you guys.
Yeah, Painted Turtle.
Yes, and then I can actually probably look up the other ones, and I'll write down any of the other camps. I can type them in the chat. That I'm not sure exactly what the requirements are for volunteers. Like I do know there is a Camp Oasis that does Crohn's and Crohn's disease, but that one they usually have counselors that have the same chronic illness, so that way they're able to relate to the children a little bit easier too. But I will type any other camps into the chat as well.
All right,
I
well,
can answer Amy's question too. Yeah, Amy, there are some hospitals like Children's LA being one of them that do have, this is a mandatory requirement for any volunteer in the hospital, no matter what department they're going into, that they have to have so many hours. I don't know, exactly the amount, but that they have to have so many hours in as a general volunteer in the hospital before they can volunteer in a specific department. That isn't the case for every hospital, just so you know. For instance, it's not the case for Miller Children's, but that is the case, I know, for Children's LA, and I believe there's one other hospital right now, but it's escaping my memory. But so it actually, I know it sounds terrible and sounds like, oh, I just want to get into the child life department to volunteer. But I will tell you, especially volunteering for a very large medical center like Children's LA, it is helpful to have those general volunteer hours. You really learn the medical center, you learn where things are, so you're so much better able to help children and families, and sometimes employees too. And so it's actually a really, it's a good thing. I know it sounds like so many hours, but it is a good requirement. But I do know, I mean, for a fact, not all hospitals require those general volunteer kind of prerequisite hours.
Well, I want to thank Professor Groschert for coming in here and giving us this wonderful information. I think we got a lot of helpful ideas about what to do in order to get through the pathway. And maybe, Professor, can you put your email address in the chat? If any of you plan to take child life classes, I'm going to talk about those in just a moment. You will be taking those classes, especially 4260 and 4460 with Professor Groschert. And so you will get a chance to ask lots more questions at that time as well. So thank you so much for coming in this evening. Does anyone have any last questions for her before she leaves? All right, well, thank you so much. It was,
Bye, everybody. Thank you.
Very helpful. So just to kind of reiterate, if you are interested in pursuing this, that your child development degree is perfect for that. And so if you are interested in talking a little bit more, you certainly will want to take the child life classes that we have. And I'm just going to, remind you about what those are in just a moment, but you can always email me, Dr. Dennis, if you have questions about enrollment, permits, and other questions about electives. And then if you need more specific advisement, I'm usually available to meet with students and talk more about careers and things like that as well. And so as you can see, when Professor Gosher talked about the classes that are required, you know, it looks like a lot of classes, but all of these are sort of baked into your child development degree. And so most of these, 1400 is a required class, 3400 is not necessarily required. You either take 3500, which is middle childhood and adolescence, or you can choose 2100, which is infancy. So as long as you choose 3400, then that's, you know, already required. 3210 is already required. 2000 is already required. So really all you need in order to make sure that you get all of the classes for child life is to take 4260, 4460, and 4800. So when we say, you know, that we have a child life specialist pathway, what we mean is that when you're going to choose your electives, that you want to make sure that you choose your electives. Everybody, to get your bachelor's degree in child development with option 1, you have to take your 7 electives. Choose at least choose those 3 classes as your electives, and you'll meet the requirements for child life specialist. We used to call that pathway the child life specialist pathway. We've changed it now to call it the children in healthcare settings pathway, because we want to make it clear that yes, those classes will help you to become, they meet the requirements for child life specialist, but to become a fully certified child life specialist, you have to go not just those 3 classes, but you also need the full bachelor's degree. You need the intern, you know, the practicum, you need the field work and the internship and the exam, and that there's much more to it. Some people were taking these 3 classes and then kind of going, well, where's my certificate? Where's my, you know, certification? And it's obviously not quite that simple. So we're trying to, you know, we changed it to the title of the pathway to the children in healthcare settings. But yes, our courses, we still have these 3 courses. These 3 courses are offered every semester, and they certainly will help you to become a child life specialist. But remember, you need 7 electives. So if you're interested in other electives, then any of these down here are other electives that are also relevant to working with children in healthcare settings. And specifically, you will want to look at this HHS 4950. This is field work in healthcare settings, because this is where you can make sure that you're getting, that you can actually be supervised by Professor Gosher and Professor Fingerhut, who's also a child life specialist that we have. And they will supervise you to do your 120 hours in a hospital setting as part of that course. You can do that as part of 4260, the hospitalized child course, but starting next year in fall 2024, that class is no longer going to have the fieldwork with it. Instead, you're going to do the fieldwork separately. And so you're going to do the course part with the 4260 and then the fieldwork part with the 4950. But we will still offer all of these courses on a regular basis, and you can you know, take these as your choices if you're interested in becoming a child life specialist. So if you have questions, you can always email me, and if you have if you would like to know more about child development or other career pathways, then again, I will put my email in the chat. I had it up on the slide as well. Sorry, that's my kitty, Jen. Jen, what's your question?
I have questions for earlier on the other slide. On the bottom, it says the 3 additional course related content areas. Would that also be, can we use the electives that you have listed right now to use that as a 3 additional course?
Yes,
does it have
but
to be
that
completed?
course just means 3 other child development. So your other required classes that you're taking, 4120 and 4300, all of those, you'll have far more classes than you need, that you don't have to even choose, you know, these 3. They just means any other 3 child development classes, and you as required, you'll have far more than that. Does that
Okay,
make
got
sense?
it. Yes. Thank you.
All right. So now we get to hear, we did get to hear about Professor Goshert's experiences becoming a child life specialist, but we have someone who is a little more close to little more recent graduate in child development. And so welcome, Amy.
Hi,
And
everyone.
so it's good to see you this evening. Thank you for coming in here, and we're excited to hear about your experiences. So I'm going to kind of do Q&A, and again, we have time for some questions at the end if people want to put their questions in the chat. You can ask them for Amy as we go along. So first, I'll let you introduce yourself a little bit. Tell us about yourself, your educational and your employment trajectory.
Yeah, so currently I am a child life specialist at Miller Children's Hospital. I work primarily in the pediatric ICU with a sprinkle of the outpatient surgery. I actually got exposed to child life pretty early on. When I was in elementary school, my brother was diagnosed with cancer, and so he had a stay at CHLA. And while we were there, we kind of had some experiences with the child life specialists that were in that area. And it got a little bit exposure, and it really stuck with me, just kind of the work that the child life specialist did. But I, of course, being so young, didn't really know exactly how to get into that field. When I was in high school, I actually got the opportunity to do a program that's over the summer that's called Camp CHLA. And this program allows high school students to shadow different careers within the Children's Hospital of Los Angeles. And you get to pick different careers that you get to shadow for a day or a couple hours within that day. And one of the ones I was able to choose was actually a child life specialist, and just kind of gave me more exposure into that world a little bit more in depth. Moving on to college, I actually went to Cal State Long Beach for my bachelor's. I have my bachelor's in psychology with a minor in child development. For a few years, I was going back and forth between the idea of being a child psychologist or being a child life specialist, but I just didn't know how to enter that field of child life. And as part of my courses for my bachelor's degree, I needed a fieldwork hour, and it was 90 hours. And the psychology program there gives you a list of places where you can complete this fieldwork. And one of the areas was actually Miller Children's Hospital. And it said specifically the child life program. And I was like, it was like an aha moment that I didn't even know that you can even volunteer in a child life program at that time. I hadn't really heard much of it spoken within my courses. And so I decided to do that. I was interviewed, I got the volunteer program, and I completed my 90 hours. As I was completing the 90 hours, I realized that that was the field that I needed to be in. Like, seeing the work that the child life specialist did within the playroom, just solely that experience, I knew that this is where I wanted to be. I knew I needed the 120 hours to complete the practicum. It was different from when I started. The practicum just really was 120 hours of volunteer work. I didn't need the assignments at the time. So I completed the 120 hours there, and then I moved on to being a general volunteer, and I continued to volunteer until after I graduated from Cal State Long Beach. I knew with the minor in child development that I needed more experience to be in this field. So I actually took it upon myself, and I took extra classes at the Long Beach City College for a year that didn't really go towards a degree or anything like that, but I knew that I needed more experience with children, even though a lot of my psych courses I did gear towards child development and working with kids in with autism or with neuro disorders and everything. But I did the extra year, and I actually got hired within a few months of graduating from Cal State Long Beach. I got hired as a child life assistant at Miller Children's. And I was so excited because it just put me more into that world. And the same thing, like Rita said, I started off doing weekends, I started doing nights. I was in the sibling playroom primarily for a long time. And I worked as a child life assistant for a couple of years. And then I moved into actually pursuing the child life internship. And I was actually fortunate enough to get the child life internship at Miller's. And Rita was great in that she let me do the full-time child life internship and then keep some night shifts. So I was working as a child life assistant at night and then being a child life intern during the day. And I had to really separate my roles during that time to make sure that, you know, I didn't cross any boundaries within those roles. And I was actually the last rotation to complete 480 hours of internship, and now it's moved up to 600. So I did the 480 hours that I needed for the internship, and then I completed my internship in December of 2017, and I took my certification exam in March of 2018. I was very nervous going into the exam just because a lot of my coworkers have had different experience where some have passed the first time and some had passed within like a couple tries. And so I think seeing both sides really helped to know that everything would be okay and that these people who had done it once or twice or more were still these great child life specialists. And I knew I could see that the ones who had taken a few more times had so much strength and like they just kept on going. And so that was a motivation enough for me I was like, if I don't pass this first time, it gives me experience to know what the exam kind of holds and I can try again the next time. Fortunately, I passed that first time. And then I continued to work as a child life assistant after passing my certification exam, just because I knew that I wanted to be at Miller's for my career. I knew that's where I wanted to be. The people I work with are great. Rita's such a great manager. And so I kept working as a certified specialist, but I was an assistant at the time. So I just kind of kept working, kept picking up any areas that I could work in to show that this is what I wanted to be in, to show Rita that I wanted to be a specialist there and that I will work hard to earn that. And fortunately, a specialist position opened up. I interviewed with her and I was able to get it. And during my internship, I saw that the area that I really wanted to be in was in the pediatric ICU, just because of the different level of care that we provide for the families. Like as much as we say it's family-centered care, it really is family-centered care in the pediatric ICU, just because some of the children may not be awake during their first few days. So we really do provide that support for the parents and the siblings during those first few days. And then we continue that support onto the child once they have improved health-wise. So it's just kind of great to see that rapport being built. And so I knew that's where I wanted to be. And I just kept working as a child life specialist. I worked as a specialist in our clinics, in our emergency department, in our outpatient surgery, until finally now most of my shifts are in the pediatric ICU. And during that time of that transition, I went into my master's program. I was lucky enough that I got into the master's program at Cal State LA. And so I was working at Miller's as a specialist during the day, and then at night I would go to the courses at Cal State LA. Unfortunately, my last semester at Cal State LA was the semester that COVID hit. So I chose to do the thesis project route that we have there at Cal State LA. And so I was fortunate enough that they were offering extensions, just because I was working in healthcare in the beginning of COVID and everything was changing so fast that I was very stressed to be going through the changes in healthcare and then also the changes in school and having to do my thesis project. And so my thesis project actually centered around camps and having a way for families to find these camps for their children and for themselves a little bit easier, just because right now you have to go to search through Google to find all these different things. And so I went through that process and I was able to get an extension, and I finished my thesis project in the summer of 2020. So, and now I'm here.
Wow. So you were able to become certified before getting the master's. So that's interesting, because I think some of the other people that I've talked to sounded like they often did the master's as a way to kind of get their practicum and get some, get some of the other to make themselves a little bit more able to get the internships and things like that. So that's an interesting that you were able to get certified and then get the master's afterwards. But so to see that there's multiple ways of getting.
Yeah. I just knew I wanted to get the internship and everything started as a child life specialist as soon as possible. And I personally knew that a master's course in child life was personally not for me. I wanted my, I think, experience to be a little bit more broadened, and just because I knew I was going to be working with families in different ways, and child life programs and master's programs offer that really greatly, but I just wanted a different experience for myself. So I knew that I wasn't going to have to require the internship for my master's. And so I did it ahead of time, and I was able to do that before my master's program.
Okay, so can you tell us a little bit about what your typical day looks like when you get there every day?
Yeah, so I can kind of just walk you through my day today. So I got to the hospital around 7:30 this morning. We have what is called multidisciplinary rounds in the pediatric ICU with the doctors, the social workers, nursing, respiratory, pharmacy, dietitian, the physical therapy, OT, PT, ST, all of them. And what happens is that the doctors go through their patients that they are assigned to that day, and they tell us what is going on with that patient. And because it's a multidisciplinary round, they are able to reach out to the different specialties that they need for that moment. So if they need something from child life, like a patient is going for a certain procedure or they're having a hard time coping, they can let us know in that moment. So that way we can make note of it and prioritize our day by that. Or if there's a social work need, like basic housing or financial assistance, and different items that social work does help out with, they can reach out to social work, respiratory, everything like that. So we're all in one place in that morning. And then afterward, I do try to check charts. So we chart on every patient that we see. We do an introduction chart within the first 2 days of them being there. And then we do check on the patients every day. And then we also do follow-up chart notes to kind of see that our services are continuing. So by checking the charts, I get to see who needs to actually have a physical chart note, or who can get what we call a doc flow, which is basically just checking off boxes that we saw them and what we provided. So it's a very condensed version of our notes. And these notes do go into the patient's charts. They're more of narrative notes, so we just kind of describe what we have done with that patient and their family. I do work with another person on the unit who is great. She and I work very well together. So then after we are done with the multidisciplinary rounds, I go and meet her in the office, and I fill her in on everything that has been done or said from that multidisciplinary round. So we are both on the same page. And then what we do is we divide the unit, so that way neither of us is taking on the whole unit by ourselves. Especially right now, we are very busy with flu and RSV. So we do have a higher patient load than we've had in the past few months. So that way the work is divided. And then from there on, we just prioritize our patients based on what we have learned through the multidisciplinary rounds, and then through checking the charts and reading the notes from the medical team as well. And from there, we either provide items to normalize the hospital environment for them, or we do the preparations. Today, a bulk of my day was with sibling support for a patient and their brother, and family support at the same time. So that was a bulk of my day, is building rapport with that family that I had started on Sunday, and just continuing it to make sure that they knew that we were there and providing the support they were needing during this very hard time for them.
One of the things that, is the main classes that you have to take, one of the key is the play therapy. Do you actually use a lot of play therapy on a daily basis?
Yeah, we do. Especially, like I said, right now we are going through this whole respiratory season. So a lot of our kids are have to do breathing treatments, and that includes a mask that stays on their face depending on how bad their respiratory rate is at that time. So they will wear a mask until the doctors can switch them into a different form of oxygen. And then they also get a vest that kind of shakes their lungs to kind of break up the mucus. So both of those things, having to wear a mask and having to wear a vest at certain times that shakes them, is something that's not easy for our child. So most recently I had a 3-year-old who was having a really hard time with the mask, and the mask they had even decorated as a dinosaur, and she just didn't want anything to do with it. So the doctors and the nurses asked if I could go in and help with that. And so basically something that we did was I had a medical doll with me that is just like a blank cloth doll that she can draw on. We have hospital gowns that are donated with them as well for the doll. And I brought up markers with me. And so we were able, as she was doing her breathing treatment, we found out what worked best for her. we put the mask on the doll first, then we put it on her. And as we're doing that, they're putting on the vest, and we're trying to make it more of a fun, like, oh, are you getting a tickle? Like trying to make it something that's not as scary, because for her mom, the breathing treatments were steadily becoming more hard for her, more complicated, and she would become more fussy. She would cry more. So they called me in to kind of see if I can de-escalate her from those reactions. And so we brought in the stickers that go on her chest, and we put them on her doll, the pulse oximeter, which checks to see how she's breathing. We put one on her doll, the same thing with the blood pressure cuff. And then afterward, we transitioned to just sticker play. So we had these sticker scenes that are really great. And so we slowly transitioned from medical play into play. And she actually did really great, where the mom's like, this is the best I've seen her do since she's been here. And so what we did is I continued that by giving them parents more sticker scenes to do at the bedsides when I couldn't be there for her breathing treatments. And mom says that those sticker scenes have been very helpful. Like they kept her distracted during the breathing treatment, and it kind of made the breathing treatment at a time where that's where they would only do is do the sticker scenes. So it was like a special time for her to do that and play with something that she really enjoyed.
Thank you. That definitely helps to kind of give an idea of like of what kinds of things you do with the kids. So
Yeah.
tell a little more about, how did your classes or your field work experience in child development? It sounds like you were mostly child development master's program, but you also did the minor in child development at Long Beach. But how did your child development classes prepare you for this?
I think they prepared me just by giving me a really good like foundation for what I do now. So learning those child development like stages that we talk about, I know they bring them up in every class, and by one point it just becomes second nature that you know what these development, these theorists and what they are, and you get to actually see them in play. The biggest thing that we do see is that trust versus mistrust that we learn so much about. We see that so much in play. We see the separation anxiety that patients have with their families. Maslow's needs, we need to meet their basic needs, and we're meeting that basic need for them in the pyramid. So we get to see all these things that you like, as much as we hear them over and over again, we get it really does help, because the repetitiveness of it, like you get to see it and you just kind of leap into it, and you can tell when a child's having a harder time coping just based on that foundation that we have. As far as the field work, my field work for my bachelor's, like I said, was at Miller Children's Hospital. And then my field work for my master's was actually at the camp, Ronald McDonald, for a good time. So the camp is very unique, in which we are there for 8 to 9 days at this camp. And so my days were 16-hour days, if not more. So all those hours did count for my fieldwork. I was able to complete the 135 hours within those 9 days, and plus the trainings that go on top of it, just because since I was a camp counselor prior to that, I did take on a new role in order to qualify for the fieldwork. So I took on the role of a director. So I had to go through director training. I had to help with the new hire orientations that we did. And then I had to take on the director role within the camp within those 9 days. So I had a very condensed version of my field work within 9 days plus the extra trainings. And it really did help just kind of seeing the different experience that these kids had from a different lens as a director, because we are helping the counselors that are there and helping them. So I did have to use a lot of my child development learning that I had done with my minor in my psych courses and my master courses to help these counselors provide the best care and the best support for the campers that they were taking care of.
Great. So yeah, so I mean, I think that's one of the big takeaways that I'm getting, is that the summer camps are actually a great way to get even more experience outside of volunteering at hospitals.
Yeah, so it's just a different way to kind of see it. It can't, like we said, like the Peanut Turtle offers a lot of different chronic illnesses and different camps specifically for those children with those chronic illnesses. And then it offers separate camps for the siblings of those chronic illnesses. So that way it builds a support network. And then Camp Ronald McDonald is just specifically the oncology camp. But there are different camps that, like I said, I'm not familiar as far as their volunteer classes that much, but they are there to kind of help support and very specific to those diagnoses as well. So it's just a different way to kind of get that support outside of a hospital or get that experience outside of a hospital.
So you already have touched on this a lot. What was the process of becoming a child life specialist like for you? It sounds like you were able to get an internship pretty early. You didn't have to apply more than once? Do some people have to apply more than once for the internship?
Yes, unfortunately we do. So within our child life program, we have a partnership council, which is I am a part of that council. And we go through all the applications that we receive. And we do see that there are students who do apply more than once. And like Rita said, it's very difficult to discern from those applications alone, like who we would like and who would be a good fit with our program and who we can see being a part of the child life internship program as well. And it's just it's experiences, it's the internship, it's I mean GPA and all those things, but it's also the interview itself that's a big portion of it. So we do narrow down the applications, and then from those applications we do interviews, and so a lot of it is the interview process as well.
And then even doing the exam, you were able to pass on the first try. And I know that a lot of people don't pass on the first try. What was the process of sort of preparing for the exam like?
So at the time, I think they've changed the exam since I had it, but I was fortunate enough that I had people before me who had taken the exam, and they had created these study guides that kind of broke down everything. And so they shared those study guides with me. I also did it based off in our internship program, we offer, like, it's called like the Handbook of Child Life Professionals, I believe. It's like this big old thick textbook that kind of goes through everything. So I would reference those study guides with the material in the books just to kind of help. And I would just, the study guides that I had were already typed, but my learning style basically is me writing out everything. So even though I had them typed in front of me, I would write everything that was on those study guides plus additional information from the books. I would handwrite them just because it's just a way for my brain to kind of absorb that information a little bit easier. Some people study for months at a time. I study 2 weeks before the exam, just because that's the information is going to be fresher for me personally. I studied for 2 weeks nonstop. Whenever I got a chance, if I had a moment at work where I had a moment to look at my study guides that I had written out with the additional information, I would read those and just kind of go over it over and over and again until I felt like I was confident in the information. But the thing is, the exam is also on a computer. It's not like it's on a paper, so that, and it's multiple choice. But you know your test style the best. So you know how to, if you, with multiple choice questions, you can kind of prepare for that. And it can be a little bit tricky, like you're reading the exam question and you're looking at the answers, and sometimes the answers there are two that look really great. Like, I would do probably both of these in this situation, but you have to do the one that's best fitting. So it's just kind of like training your brain to remember that information and seeing like what like textbook answer is kind of needed at that moment. And if possible, taking the exam as soon as possible after your internship, just because sometimes people do wait a little bit. And like, I think it's easier if the information is a little bit fresher in your mind from your internship. But obviously, if that doesn't work out, like, take it as soon as you can after your internship as well.
Good. All of that is great advice for especially for test taking, like something like that. So tell us, I guess, what do you think is the most rewarding aspect of this job?
I think the most rewarding aspect of the job is seeing, so like I said, I work in the pediatric ICU, so I get to see these kiddos from the beginning where they are at their worst to then slowly seeing them transition. And luckily our office is right next to one of the general pediatric playrooms. So sometimes I am fortunate enough to see these kiddos that were very sick in the ICU to going and being in the playroom sessions and seeing the progress that they have made and seeing how much better they are coping throughout that transition, just because they are able to do play and they're able to experience things that are normal for them. And seeing like a child go from being very nervous for maybe a procedure to doing the medical play with me. Like I had a 4-year-old who they wanted her still for an MRI, and an MRI can be a pretty lengthy process, and it's something where the child has to remain absolutely still for, so they don't get any blurry pictures. And they wanted to do that without her being asleep. So they wanted her awake throughout the whole process. And so I was able to do medical play with an MRI and show her and give her jobs and told her what to do. And she wanted me to go down with her to MRI along with her mom. And seeing her actually remain still throughout the whole MRI, I was able to talk to her and be like, "You're doing so great, Finley, you're doing this." And then as soon as the MRI was done, the bed slid out, she sat up immediately. She was like, "I did this." And like, she was just so proud of herself, and seeing that like this child gain that confidence from something that she was very nervous from, and seeing her gain that confidence to know that she was able to do something that was hard, and just being able to provide that support for her and give her that was something that's really rewarding for me.
Yeah, that sounds, and it sounds like you have those kinds of experiences, on a daily basis. So it does sound very rewarding.
Yeah.
But at the same time, there's, I'm sure, challenges. What's the most challenging part?
I think it's two-sided in that, like Rita was saying, we are still educating some staff in like the hospital environment as to what we do. And so, I mean, getting them to change their mind into what we do, and seeing that like sometimes we're referred as the play people, and yeah, we do play, but like I think changing their minds and seeing what the importance of that play is something. So it's like, trying to change these ideals that they have and trying to change their perspective of what we do. The other difficult things is I do deal a lot with death and dying and bereavement. And so just kind of having to deal and like explain like to a sibling that their brother or sister is dying or has died, and being that support and helping them process that information is very difficult to do. But I also see the benefits of it for that child and for that family to kind of provide that support for them. So we are being honest with them, and we are building that trust within their family as well, and providing some kind of comfort during that very difficult time.
Alicia has a question.
Yes.
So my question is, how do you deal with it? Like, what is your mental, I guess, like, how are you coping with it? Because I'll give you an example. My cousin is actually a phlebotomist at Children's Hospital.
Okay.
And her first month of working solely with children, because she would only work with adults prior to that. She had years of experience working with adults. And her first month of working with children and being in that setting, it was really difficult for her. So I'm a little anxious, I guess, to kind of start that part of it. So how do you cope with it?
So I am very fortunate that I am, like I said, I'm surrounded by a great team. The members of our child life team are just such great people that we've become very close friends actually outside of this, and I know that I have that support system. So if I'm having a situation where I'm not really sure how to address how this child's coping or how this family is dealing with a certain situation, I know that I have them to kind of bounce ideas back and forth with. Like, I'm like, what would you guys do in this situation? Do you guys have any ideas for me? Have you guys had this experience before? And then most recently, I've kind of learned that our job can be taking on a lot of emotions and giving a lot of ourselves and holding space for these children and these families. So recently, something that I've learned for myself is taking a day where I just spend time with just me. Like, I go to breakfast by myself. I love to read. So that always is something else that kind of helps take me out of my own mind. So I went to a bookstore. I took my time without anybody rushing me to like move on to the next thing that I had to do. And it was just something where a day where I didn't have to give myself to anybody else. And I didn't have to hold space for anybody else's emotions but my own. And so just realizing what kind of helps me was that. And so that's been very beneficial. Phlebotomists have a hard job, they're the ones that poke. And a lot, kids don't like to be poked. So that's always something that's very difficult. But a lot of our time, like our jobs, like we know that the kids are going to cry when they get poked. So what we do is helping them bring them back to their baseline and seeing, I think sometimes seeing them go from having a hard time coping and crying to then going back into being their normal playful self, I think is something. And like those good moments, like I said, like the little girl jumping up saying that she did it, seeing them go back to their baseline after crying, the appreciation of a family after we've done the bereavement support, those moments I think kind of help fill our cups a little bit again after having some hard times.
Thank you.
Yeah. So we're getting toward the end of our session. What advice would you have to our child development majors out there that want to get into this career?
I think it's just perseverance, to be honest. Like Karita said, it can be a quite competitive of a field. And it's also along that, it's finding the space where you feel the most comfortable and you feel like you have a team that surrounds you and knowing what's best for yourself. I'm, like I said, I have a very great team with me at this hospital, so I've been very fortunate, but along with it is like leaning into my support of my family who have helped me out a lot throughout like my working and going through my master's program at the same time. They were very great and very supportive to help me deal with times that were tough for me. But I think it's just like perseverance and knowing that if this is something that you really want to do, that you just keep on going and you keep working hard on it and know that hard work will pay off eventually.
And I know that, you often work in hospital settings. It sounds like there are a lot of other team members. Are you familiar with any other careers in the health field that might be similar that you would recommend that are somewhat related, or other things that people might want to think about?
So we do have a child psychologist team at the hospital, so that's always an option, and it's very specific into what like children in healthcare. So a lot of times like they come into contact with children who have already been established with therapy, but different triggers in the hospital setting can be very difficult for them, and knowing what those triggers are and working with them and kind of giving them coping mechanisms alongside with the child life team is something that I've seen. There's also like I said, there's physical therapy, speech therapy, occupational therapy, and recreational therapy that we have at the hospital, and they all work with kids, and they all obviously offer different careers, but I think having a basis in child development would probably be very helpful for them, because they do focus on developmental stages and where these children are supposed to be at this point. As far as like with child development, I feel like it's very limited into like child life specialists and psychologists, but I think everybody who works in a child life in a hospital setting could use like these child development courses, to be honest. Like I think it just offers a great basis and to know how these different children cope at different stages. And so I mean, I think if you have a basis in child development and if you wanted to go into a different field into healthcare, and you want to work with pediatrics, I think it can only help you, to be honest.
Thank you. So